In a quiet but deeply consequential move, the Trump administration has ended federal support for a program that helped America's most vulnerable citizens, the disabled and impoverished, secure vital disability benefits and avoid homelessness. This change, made in August but largely unnoticed until now, marks another setback for low-income Americans struggling to survive. The program in question funded specialized training for SOAR, short for Supplemental Security Income, and Social Security Disability Insurance Outreach, Access, and Recovery. SOAR-trained caseworkers have long been the bridge between desperate Americans and essential federal aid. They help people with severe disabilities apply for programs like SSI, which provides monthly cash support to those too poor or too ill to work. In 2024 alone, SOAR-trained workers helped over 3,000 people access benefits for housing, healthcare, and food assistance. Experts say these benefits often make the difference between having a roof over one's head or ending up on the streets. But now, with the federal funding gone, the burden shifts to the states, many of which are already financially stretched. Without national funding, states must independently maintain these programs, much like what's happening with the recent cutbacks to SNAP and Medicaid through the so-called One Big Beautiful Bill Act. To put the numbers in perspective, the annual cost of this program was about $2.6 million. That's a small price tag for a program that kept thousands of disabled Americans from becoming homeless. Veterans Affairs even recommends SOAR training in certain cases because of its proven success. Yvonne Perret, who first designed the SOAR model in the 1990s, says, "We're talking about helping the most vulnerable people in the country. The cost was minimal compared to the impact." The Department of Health and Human Services confirmed that the federal SOAR contract ended on August 18th. In a statement, the department said the decision was meant to give states and local organizations more flexibility to shape programs according to their needs. But the reality is that without financial backing, many states simply can't afford to keep it going. Applying for disability benefits is already an overwhelming challenge. The process is filled with paperwork and legal complexity, something nearly impossible to navigate for those without a stable address or mental health support. According to the Center on Budget and Policy Priorities, people who receive SOAR assistance have a 65% approval rate, more than double that of applicants who go through the system alone. Meanwhile, cuts to Social Security staffing have only made things worse, slowing down approvals and leaving thousands of disabled applicants waiting for help that may never come. And here's the bottom line: cutting this funding doesn't save money in the long run. When people lose access to housing or benefits, many end up in hospitals or jails, both far more expensive for taxpayers. As Yvonne Perret puts it plainly, there's a cost no matter what. So while this change may look like a quiet bureaucratic adjustment, for many struggling Americans, it could mean the difference between stability and survival. Before you go, make sure to subscribe to InsightPulse, your destination for deep, fact-based analysis of global and national stories that truly matter. Hit the like button, share this video, and turn on notifications so you never miss an update on issues shaping our world today.